And I'm the director of the Mayor's Public Engagement Unit for the City of New York. I'm proud to be here with you, the early risers, the get things doneers, the people who will be at the first panel to make sure they're taking everything they can away from this amazing conference. And I'm happy to be here under the banner of, can 21st century government heal what ails us? Everything that ails us? Definitely not. But New York City is working on a new form of government that's showing really promising results. And I'm pleased to be here with you to talk about them today. I think that if we take this new form of government, we have collaboration across other cities, we can get one step closer to a treatment that can bridge that gap, heal that divide between government, that people are feeling between government and their people. So what ails us? This is something we heard a lot before the last presidential election.
I think government people don't care about America anymore. I think they're more interested in the next election and less interested in what's right for the country.
I'm supporting Donald Trump because he is an outsider and he's not an establishment politician, and I want somebody to come in and drain the swamp, get rid of all those career politicians who have just been milking us for money and votes, and they don't care about us once the election's over.
We need a president that cares about the common people.
Right. So we heard a lot of this. Government doesn't work for me. Why should I be investing in government? Let's change it all. Let's get somebody in there that's going to do things that affect me and benefit my life. And they made their voices heard at the ballot box. So did folks get what they wanted? Well, we saw in their elected choices budget that the cuts that were proposed disproportionately impacted just those people who had voted for him. We see up at the top here a woman from Beattyville, Kentucky, that overwhelmingly supported Trump, 57% of whom would be hurt by the cuts that he put in his budget. So what happened? Let's get back to that root question, that root problem. Why do people feel that the government isn't working for them? And what can we do to address that? Well, there's a few different reasons in this structure that folks might think that the government doesn't work for them. Maybe it doesn't. Maybe people that should be receiving the benefits of government simply aren't. And they're paying into a system and they're not seeing anything back from it that they should be getting. Number two, maybe they are getting the benefits of government, but they don't actually know that it's coming from government. We remember that famous Jimmy Kimmel clip where folks benefiting from the Affordable Care Act were asking to cut Obamacare. Or third, maybe they are receiving benefits from the government. Maybe they know where it's coming from, but they don't feel that government is listening to them. They don't have a relationship with government, they don't feel that they can access government, and they don't think that it's worth investing in. So let's address that. Let's take some time and make sure that those of us in government are building relationships, that we're closing the divide that people feel between themselves and government, and that responsibility is on us, especially at the local level where we have as much touch on the folks that we're supposed to be serving as possible. So a model that we're working with here is moving people from government doesn't care about me to actually, government impacts my life. But it's not just about impact, it's about access. If I need something, I know where to go. If I want to give my input, I know who I can call. If I have a question, I know how I can get that information. But then it's not just about access, it's about impact. I want to change something. I want to make my voice heard, and not only is somebody listening to me, but I have a relationship, and I know that I'll actually be able to influence what happens. And from there, you hope that that divide totally goes away. You realize that I am government, and maybe even in the end, you want to lead government or you want to organize on your own. And so this is where the work that we're pioneering in New York City comes in, here at the front. This mayor in New York is an organizer, and 2 years ago, he said, I'm going to take campaign-style, field-style tactics, and make sure that we are being as effective as possible in delivering resources to New Yorkers, the most vulnerable New Yorkers, making sure that they can live in this city productively and with a healthy life. So the New York City Public Engagement Unit was formed. Our goal is to increase that outreach. So I could tell you all about the work that we do, but let me give you an example of the kind of work. So one of the units that we have is Get Covered NYC. Our job is to find people who, we have a by-name list of folks who've used the health and hospital system, and we're able to follow up with them directly to get them insured and build a relationship with them. So here's an example of how we do that.
Hola, me llamo Alejandro y trabajo con la ciudad de Nueva York. ¿Habla español o inglés?
I speak French and
Oh, okay, awesome. Hello, my name is Alex. I work with the City of New York. This is my
Hi,
colleague.
I'm Yuri. Nice to meet you.
We're just doing street outreach today, just to let you know we're from Get Covered NYC. It's a city initiative to help New Yorkers get health insurance. I'm not sure if you have it or it sounds like you would be either eligible for Medicaid or an essential plan, maybe like $20 or zero, no cost a month for a premium. But we could take a look at that.
yeah, sure.
Okay, awesome. So I would make an appointment right now.
Okay.
Along the way, we will be helping you. So just remind you on your appointment, what documents you need to bring in. That day, if you want to schedule it, something comes up, we can call you, you can call us just to reschedule that. Checking up on you after your appointment just to make sure that you got the health coverage and care that you needed. And again, we're here to help you with the whole process.
So this might not seem revolutionary for folks that have done engagement, but for city government, it is. We are not waiting for somebody to come to us. We are going to them at their door. And there's a few key things I want to point out in that interaction. They started speaking in language. We normally hire canvassers that come from the areas that they're canvassing, maybe sometimes down to the blocks. We've got exactly the in with the constituent that we need to develop that trust. If you notice, he will be giving, after Alex speaks to this client, he handed them an iPad that can work offline. We can do all of their intake information, also something that's new in government. Then he'll hand them his business card. They'll have a back and forth until this individual gets to their healthcare enrollment appointment. After their healthcare, if they miss their appointment, we'll reschedule them. After their appointment, we'll follow up with them to make sure that they get a wellness visit at the hospital. But it doesn't stop there. We'll also screen them for all the other things that they might be eligible. SNAP, maybe they have a senior who is eligible for senior rental assistance. Workforce One, if they're at risk of eviction later on, we'll continue following up with them. After the last presidential election, we had a flood of calls coming into these individuals where folks said, look, I have a green card. What does that mean for me? I heard that if I'm on the public charge, if I'm receiving assistance, that could increase my risk of deportation. What should I do? They had a person in government whose name they knew that they can access. And so it's not just health insurance. We have two other main units. One that is called our tenant support unit that goes to folks who are at risk of eviction in rapidly gentrifying areas and finds individuals through door knocks who are either being harassed by their landlord or need to be connected to legal services. We make sure they're able to stay in their apartment. And we also have a unit which works with landlords across the city to incentivize them to rent to people who are in shelter with vouchers, and we case manage individuals in shelter into permanent housing. As we do this, we are using and developing the tools that other city agencies have started to take notice of. When the Department of Consumer Affairs wants to make sure they get the word out about protecting immigrants, we plug in to help them. When there was a problem with a disease carried by rats in the Bronx, the administration needed folks who were used to being out in the field and talking to people and developing trust and making sure that they were taking the precautions they needed to do. So we came in with our outreach team to lend a hand. And it's not just lending extra support. We have worked with lots of administration agencies to help them with their overall strategies. We've worked with NYCHA, making sure people are engaged in new policies affecting them, making sure they're signing up for Workforce One. We've worked with NYC Service to help them with their branching scripts to pair people that want to volunteer to the appropriate volunteer avenue. We've worked with the Office of Emergency Management in PICO so they can find volunteers in an emergency and make sure that we're actually case managing people through what they need effectively in an emergency, helping folks get more summer meals for kids that are eligible through smart targeting and smart outreach efforts, as well as work with the fire department. But it's not just about field, it's also about the tools that we're developing. We're working with the Mayor's Office of Operations on a tool called Access NYC, which I know lots of different cities have, with the goal of screening people not just for one thing at their door, but for 30+ fiscal supports and case managing them through that process. We're building tools that go between agencies. This is a tool that we use to work with the shelter system and our landlord system, like I mentioned, to actually see when an apartment becomes available for viewing, which client is going to be viewing that apartment, scheduling them for that viewing, and following up through every step. We're also working, this is a mock-up of the Canvas tool that we're working on for the entire city to be able to use, so that, let's say there's a heat outage, you go to somebody's apartment and they need maybe a bottle of water, maybe they need a fan, maybe they need somebody to check up on them tomorrow. We can put them into each of the workflows and make sure that they get what they need and they're appropriately tracked. We can pull data where there's data sharing agreements in different situations immediately up into the app in real time. So I can tell you that through the numbers, these programs are really working. Our tenant support unit has talked to 250,000 New Yorkers. They have kept 12,000 of them in their homes, preserving those affordable units and keeping them out of shelter. Our home support unit, people from shelter into housing, has saved the city millions of dollars. And our healthcare unit has the goal of saving the health and hospital system millions of dollars over the long term by finding people who aren't insured, making sure they get insurance, and having them continue to use the public hospital system. But let me just show you a couple of quick videos.
Con cáncer, Wellington Pellerano perdió su cobertura médica. Gracias a una iniciativa de la ciudad, hoy puede recibir su tratamiento.
Consiguieron mi información por el hospital Lincoln en el Bronx. Me contactaron, me preguntaron si tenía seguro, le dije que no, y ahí comenzó mi proceso.
Soon after I was discharged, my wife and 3 kids and I found ourselves homeless in New York City earlier this year. As a father, it broke my heart when we ended up in a shelter. Then the mayor's office stepped in and stood up for me and my family. A home specialist in the public engagement unit named Ms. Jacqueline Rodriguez matched us to an apartment owned by Mr. Hairless Lasso. The city helped me get a link voucher that would help us pay the rent. When I went to visit the apartment, Mr. Lasso greeted me at the door and thanked me for my service.
I've heard this from seniors all over the city. People did everything right in their life, worked hard, contributed to our society, and now are having to make choices that are very tough between doctor visits, medical bills, paying the rent. We're trying to address that issue head on. I want you to recognize these good folks. They are not seniors yet, but they're helping seniors every day. They're from our tenant support unit.
So from the personal stories, you can really get the impact of what we're doing, but you can also see it in the volume of our data. Our metrics reporting, our field launches, our teletown halls, we just had one with 16,000 people on it yesterday, our use of text messages, our use of follow-up case management, all things that we're testing in New York that I think that we should be sharing with other cities. So we are able to move people from government doesn't care about me to government impacts my life through outreach. By building relationships with individuals, we're able to actually listen to them, and we can take back the problems that we see in communities as we knock on doors and what we hear from people calling us in to City Hall. We can make those changes, and we can get back to those individuals. And we can also address those concerns, and if the mayor is coming to the area or we're one of the people we've talked to, we can invite them to a town hall, make your voice heard that way. If there's a community planning meeting, we can invite them to those meetings so that they can increase their engagement even more. So this is really a new kind of bringing organizing and outreach into government. And while I know this is New York, we have more resources, we have people that we can devote to this, we are testing and trying all sorts of different tools and technologies. I know some of the people in this room have developed those kind of tools for government. We should be testing them. We should be sharing them. We should be seeing how other cities and municipalities that maybe have less resources can amplify their efforts by using those tools so that they too can bridge that gap that people feel between themselves and government and hopefully get closer to healing what ails us. Thank you.
Thank you.